It's been a rough trek this past year over the frontier of COVID, trying to discover it, trying to understand it, trying to prevent it. It's all been quite a mess. It makes you wonder, how did we even get here? And I've brought in someone special, an expert, coming up to help tell us about how hand washing was used to fight the coronavirus.
My name is Dr. Hans Warsch, and I will be discussing the effectiveness and impact of hand washing and hand sanitizer on the new frontier of science that COVID has propelled us into. COVID has increased the importance of hand washing more than people know. Breaking into this frontier of science with this pandemic has led us to more people being more educated on the importance of hand washing and sanitizing. According to experts in Europe, the sales of bar soap, which is a much less effective form of hand washing, has decreased by nearly 20% during the pandemic. These experts also state that the sales and prevalence of liquid hand soap, which is much more effective than bar soap, and liquid hand sanitizer has also increased. Also, the sales of these different hand sanitizers has jumped nearly 600% within the past year. This rapid increase of hand soap and hand sanitizer use has showed us that as we approach the frontier of science, even what we know about the little things will change drastically from more studies and more technology. This pandemic has led to an influx of information on how diseases are spread and how to prevent the spread of diseases. Washing your hands is something that people have done for centuries, but the importance of this simple act has yet to be truly emphasized up until this point. This COVID-19 pandemic has changed what we know about science and the spread of disease. Hygiene and cleanliness, which hand washing and hand cleaning plays a large role in, will forever be changed and forever be emphasized due to what we know now.
As you saw, hand washing was quite effective in fighting the coronavirus. However, old world measures would not fight this unprecedented virus and cover this new frontier. We also had to keep in mind new measures. Among these was masks. I have an expert who has a lot of data to share with you about the effectiveness of masks.
Throughout the COVID-19 pandemic, we have come to adopt several protocols that, while relatively new to Western peoples, have been commonplace in Asia and the Middle East for years. Since the beginning of the pandemic, face mask usage has been a contentious subject in much of the Western world. Though wearing face masks is nearly a universal response to pandemics and has been for centuries, this is the worst epidemic to hit the Americas and Western Europe since the Spanish flu in 1918, and many people were unaccustomed to using face masks to slow the spread of viruses. In 2002, China was hit with the first coronavirus epidemic, resulting from the rapid spread of SARS-CoV-1, a predecessor to SARS-CoV-2 or COVID-19. The epidemic ended in 2004 after numerous protocols, including requiring face masks in public spaces, were set in place. In 2012, the second coronavirus epidemic began in Saudi Arabia. MERS-CoV spread across over 26 countries, mainly in and around the Middle East, and mask wearing quickly became common in afflicted areas. Finding ourselves in the middle of a modern global pandemic has caused many to question whether this historic use of masks does anything to slow the spread of coronaviruses, especially COVID-19. Despite its assumed validity, the science behind face mask interactions with particles as small as viruses was largely unexplored before this pandemic. The model-based analysis, effectiveness of masks in reducing the spread of COVID-19, conducted by researchers at Stanford University, used a disease model of the COVID-19 pandemic in New York State to measure and analyze the effect masks have on rates of COVID-19 infection. These researchers found that moderately effective masks, such as two-layer fabric masks and common procedure masks, can have a measurable effect in decreasing the spread of the virus, especially in cases of full coverage. However, masks should be combined with social distancing to reduce the average number of secondary cases per infection below 1.
Social distancing was another measure taken. I have brought in two experts, one of which is being interviewed to help explain the effectiveness of social distancing while crossing that COVID frontier.
According to Chang Chen et al. In 2021, 5 states, including Illinois, New Jersey, California, New York, and Massachusetts, accounted for 49.2% of all COVID cases in the United States. The authors of this article decided to use these states because the most impact would be seen from social distancing with the states with the most COVID cases. The daily reproduction number measures the level of viral transmissibility of COVID. As you can see from the graph here, the numbers are all very high before the protocols and decrease to around 1 or below 1 by May 31st, which is a few days after the protocols, depending on the state. You can also see from this graph that the decrease from the protocols to May 31st was around 50% in California and above 50% in all other states, meaning that social distancing is a very effective way to control COVID. And although the reproduction number declined in the 5 states, it did not decline to the low numbers it was in Wuhan, China, where the epidemic is currently under control. In fact, the rates we are seeing now is still considered to be high. So even though that we've discovered that social distancing works, our society is ignoring the data that shows COVID is still an important issue because we believe that we've moved past this part of the frontier. People are simply eager to return to the normal lives they knew before COVID instead of the unknowns of the future.
As a citizen of this country, I think that it is super important that I stress how necessary it is for us to continue to social distance now that we are done with the first wave. The vaccine protects from severe disease or death, but not symptomatic disease, and therefore the practice of social distancing is imperative. Most people view the pandemic and this virus as something that they have already overcome, and they have stopped considering what else we don't know about it. And because of this, the progress in this frontier has hit a standstill. So social distancing is one of the few things that we always knew would be essential to curb the spread of this virus, and I think it still is. I believe that it is a new frontier for them as well. And with less interaction with other people their age during a time in their lives where they tend to form close relationships with people of their own age, adolescents may be prone to mental illness and reduced social development. However, increased usage of social media platforms and increasing access to such platforms may decrease the effects of social distancing laws on adolescents' social and mental development. Essentially, they are using the resources they know to help them navigate the unknown aspects of life in this pandemic.
Masks and social distancing were all preventative measures. However, the end of every frontier is discovery. That was the vaccine for the frontier of COVID. And I have brought in 3 experts to help talk about the creation, effectiveness, and the overall makeup of the vaccine.
Receiving a shot initially was not an easy choice. The vaccines had been developed in less than 12 months, leaving many people to wonder about their legitimacy and potential long-term effects. In addition to this, the public did not know much about how vaccines work or how they're made. But let's take a look at how science overcame this known-unknown frontier. So there are 2 main categories of COVID vaccines, with the first being vector vaccines. In this type of vaccine, genetic material is extracted from a COVID-19 virus and put in a vector or another harmless virus. Once the vaccine is injected, it gets into the human cell, which reproduces the spikes on the surface. The immune system reacts to this by developing antibodies and white blood cells, and through this, immunity is achieved. Both the AstraZeneca and the University of Oxford vaccine use this method. The second type of vaccine is the messenger RNA vaccine. This type of vaccine uses genetically engineered mRNA to reproduce the spike proteins of the COVID virus. This is injected into the body and similarly enters the cell, where it teaches the cell how to reproduce the spike protein on its surface. Again, antibodies are developed and immunity is achieved. The mRNA is broken down right away, so it doesn't mess with the DNA of a person. Now, Pfizer and Moderna both use this technology to develop their vaccine. This has been the first time that these vaccines have been used on a large scale, which scared the public, but it was a massive step for science in overcoming a new frontier and developing a shot in that short of a time span, and can yield many more vaccines to cure other diseases.
Many people were nervous to get the vaccine because of its quick creation and the fact that little is known about its long-term effects. In a survey performed by the University of Alabama, 90% of respondents were concerned about getting the vaccine because of future safety complications. However, in a resulting paper written by Paul Gopfert, MD, director of the Alabama Vaccine Research Clinic Unit, he debunks these concerns in 3 major points. First, vaccines are eliminated quickly. A surplus of material is entered into the body through vaccine injection, but the body only keeps as much as it needs. Second, the vaccine side effects show up within 2 weeks, if at all. 3, he weighs the odds against other vaccines that have been rolled out on a large-scale basis. He gives the example of the swine flu vaccine. He says that 1 in 100,000 people experienced rare side effects. In comparison to this, so much more is known about the COVID vaccine, and we have so much more research that tells us that the odds are even slimmer than that of the swine flu. He says, in short, get your vaccine.
From the unknown and concern that arose from the vaccine came the studies of its effectiveness. Scientists and researchers from all around the world teamed up to prove that it not only slows down the transmission and spread of the virus, but also lowers the severity of symptoms and decreases hospitalizations. According to Jones, Stellick, and Glasio, their studies show that the vaccines appear to be very effective in preventing severe complications and deaths from COVID-19 in adults of all ages. Furthermore, research from the CDC for all kinds of COVID vaccines found similar outcomes sampling from a wide variety of occupations and locations, which were published from December 2020 to March 2021. While time ensues, there is still more research being done and daily updates from the CDC, which show how the vaccine is combating hospitalizations and infection. To further show the effectiveness and legitimacy of the vaccine is the FDA approval of the Pfizer vaccine. While many people were scared of the vaccine having long-lasting or harmful effects, the FDA approval shows and urges people that the vaccine is safe and effective and is useful in combating COVID.
The vaccine was what we were looking for. The ends of the frontier. The ends to which we were willing to discover and know. And looking back on before lockdown even occurred, the frontier of COVID has been greatly crossed. And even with the amount of knowledge displayed here, it is shown that the frontier of COVID is known, at least to a certain extent. And finally, there is some way to stop its spread. Through looking at the effectiveness of hand washing, the new methods to slow the spread in masks and social distancing, and finally a means to stop the spread in the vaccine, we have covered much territory and shown how we have crossed that frontier of COVID in 2020. So, mask up, be safe, get the vaccine, be knowledgeable.